Hey everyone, welcome back to the Sensitivity Doctor. Today I got to sit down with someone who I honestly fell in love with. It is rare that I stay on an extra 45 minutes after to just talk with them and pick their brain because Judith Rosen, who is a licensed clinical social worker out of New York City and works in the tri-state area, was amazing. We talked about everything from anxiety to ADHD, getting things done with ADHD, grief, pet loss, and something that I had never even known about, which is veterinary social work. I love this episode because I feel like if you're someone who has been struggling through your own grief process, from whether it's losing a pet or honestly anyone, this episode is just so validating. I found Judith to be so informative and interesting, very interesting life history. So I can't wait to have her back. She is definitely going to be back probably in the spring or summer. So if you're someone with ADHD or someone who's just had life get in the way of taking that next step or making that big risk or going out and finding your purpose, we talk all about how later in life is sometimes the best time in life to make these things happen, especially if you have ADHD, and how later in life was when Judith found her very special calling of being a veterinary social worker. You heard that right. I had never heard the term before today. So you'll get to learn something new alongside with me and also explore what it's like to fail forward, try many things, and finally find your rhythm at the right time. Enjoy. Judith Rosen, I'm super excited you're here today because we're talking about something that I had never really heard of, which is, did you say veterinarian social work?
Veterinary social work. So I'm
Veterinary
a
social work.
veterinarian social worker.
Okay.
That means that I did my master's program, my MSW. I was working as a clinical social work. I worked in the fields of addiction medicine and then community health. And I had a cat. This is a decoupage
Oh,
my
love
nephew's partner
that.
made for me. Her name was Joni.
Mm-hmm.
And she was not doing well. She had chronic kidney disease and she passed away. And when she was in ICU at Blue Pearl, which is a veterinary hospital chain, I did what every social worker does is when you're somewhere where there's a crisis, there's people that are upset. I looked around me, I saw people that were crying for the loss of their pet. I heard people freaking out, like, how am I going to pay this bill? I can't possibly pay this bill. I saw veterinarians looking so stressed out.
Yeah.
And I said to myself, as we do, as one does if you're a social worker, I said, gee, man, they could really use a social worker here. And then
Good
I
point.
thought, right? And then I thought, gee, I wonder if that's a thing. And I went home. My cat was still in care. I wasn't sure that, she was going to pass at that point. So I went home, looked it up, and sure enough, I found a veterinary social work program at University of Tennessee. It's one of the first programs that's out there. And it was, intensive online training and then a week-long intensive on campus with the social work school and the veterinary school, which is great
Wow.
because you're really learning from veterinarians as well.
Yeah.
And then I had to do a Keystone program. And what I did was, project rather, and what I did was incorporate veterinary social work principles into primary care, which is the environment I was working in.
So let me
And
ask you, are
yes,
you an HSP?
no, I wouldn't say no.
You wouldn't
I,
consider yourself a highly sensitive person?
no, what I would consider myself is, a lot of empathy.
Yeah.
But I am good at what social workers especially have to do is be able to have that distance. If I was absorbing,
Okay, good point.
I would burn out so fast.
Well, the only reason I ask is
Yeah.
because I was thinking you could not have a more empath-oriented job. I mean, you're already in the counseling and the supporting
Yeah.
world, the social
Yeah.
work world, and then you combine animals with it. So,
Oh,
but that, I mean,
absolutely.
that's an interesting point because I know something we're going to touch on today is ADHD as well.
Yeah.
And there are some overlaps with life experiences and lived experiences with people who are highly sensitive versus people who are ADHD. And then there's often both for a lot of folks. So,
Right.
but so when you now have your certificate, is it a certification?
It's certification. Yeah. It's
Certification.
it's
Okay.
it's it's not a license. It's not a separate
Okay.
license.
Okay. And so you have, I mean, I'll just launch in to make sure everyone knows if they're listening and they're thinking this really relates to me. You do have a book out now,
Yes, I do, and
right?
I have it right
You
here.
want to share it?
It's called Life After Pet Loss: Daily Reflections of Working Through Grief. And I do, at some point, if we can, I want to talk about how what the challenges were. I'm going to put it right here so people can see it if they didn't see it the first
Yes,
time.
yes. They have to see our purple vibe we're doing, the
Oh,
book, like
yeah.
all of it. We were very intentional, you
Oh,
guys.
that's my thing. Um, Before we won't go on to the book, I just want to add one quick thing about veterinary social work so
Yeah,
people
please.
understand is that there are multiple domains in which a veterinary social worker can work.
Mm-hmm.
I chose pet grief, which is,
Okay.
relate to this book. But it can also be supporting veterinarians. Veterinarians have the highest rate of suicide of any medical professional. I mean, they're the only one, at least at this point, they're the only one that euthanize their patients. And if you do
True.
that over and over again throughout the day, again,
Right.
that's back to that empathy idea.
Right.
If you're not able to have that distance, it can burn you out. So
Absolutely.
I have seen a couple of veterinarians also for stress, depression, anxiety, things like that. Then it's the link between domestic abuse and um, animal abuse. And the idea is to advocate for there be more of a conversation and more coordination between the agencies that handle both. Because if an animal is being abused, it's often, like a signal that there's more going on in that household.
That is a really good point. And it actually makes me think of, even if particularly something else that comes to mind when I think of my first book, What I Wish I Knew, that I co-authored with a survivor, Kendall Ancone,
Yeah.
who
Hmm.
her dog saved her life, actually
Yeah.
saved her life. Halfway through the book, guys, if you want to get right to the cliffhanger. But she was, like many people, hesitant about leaving because where do I go with my pet? So I feel like that's probably another thing that holds a lot of survivors back from
Oh,
getting out.
yeah. Oh, absolutely. In fact, one of the things in the movement is to have this coordination with shelters, and there actually are some foundations that are doing an amazing job. I think it, like, I can't say which one it is because I don't know for sure, but trying to advocate for shelters to allow animals. Because a lot of times, people, one of the things that an abuser will threaten is that they will harm the animal.
Right.
If you don't do this, if you don't stay, if you don't, etc., I will kill the dog, which is horrific to even say out loud, right?
Yeah. I've
Um,
heard clients tell me that. I've actually heard clients say that they feared for the life of their animal.
yeah, and it's
Yeah.
true and it's very real. So, the veterinary social worker can work in all those different domains. And because I was in primary care when I started, I that meant that I was in a clinic where the medical doctors would refer patients to my team if they had depression, anxiety, if anything was going on. And I made sure, as part of my Keystone project, to do a presentation for the medical staff about veterinary social work, about pet grief, and why it's so important for them to refer people to us to treat it, right?
Right. So
Or,
I was going to ask, I'm
yeah.
thinking of someone listening who maybe relates to this as thinking, I am afraid for the life of my pet. I've been in the field for 2 decades, and this is the first time I've ever heard of a pet social worker. So I can't imagine, and I'm hoping that people listening to this episode, it spreads the word more.
Hmm.
I'm thinking of people who don't even know about this. How does someone even go about finding this kind of resource or even knowing that it's an option? Because it almost feels like if it's hard enough for you to imagine what to do for yourself, and now you're also trying to find resources for your animal as well.
I think that a good place to start would be to going to some of the websites of different universities that do have this program,
Oh,
because they
good
have their
point.
students doing a lot of counseling and support work and stuff. I can email you a list that maybe
I
you
would
can
love
put,
that. We will
right?
absolutely share that.
Okay. And so that would be University of Tennessee at Knoxville is kind of the
Okay.
original Ohio State University. That was really hard for me to say because I'm from Michigan. I just choked on it as I said it, but
Oh, that's
I do
funny.
have colleagues that work there and they're fantastic. And I think definitely NYU, which is my alma mater. They have a program now. So I mean, my alma mater for my master's, but
Gotcha.
Tennessee
Hmm.
was for this. So I'm going to send you a list so that people can look that up as at least as a start. And I'll also give you information about something called the Link.
Okay.
They're the that's a, there's a, They have a wonderful newsletter with a lot of information. They're the advocacy group for animal abuse and domestic violence, and working on that link and
Mm.
trying to advocate in different states. They also advocate for increased penalties for animal cruelty
Oh,
and
okay.
changes in the law. Um, was it Pennsylvania? Was it New York? But there was just recently a change in the law where an animal in your household is considered family because in most states they're considered property. So that if
Gotcha.
someone
That changes
harms,
a lot.
it changes everything. So that
Hmm.
if someone were to harm an animal, God forbid, of yours, you would only get compensation for how much they are worth financially instead of it being, if there's a civil proceeding. I'm not
Wow.
a lawyer, I'm just a veterinary social work, but
No. Well,
that's
and I'm
as I
sitting here
understand it.
thinking, I do work with a lot of survivors and people who are leaving abusive relationships. And so
Yeah,
I'm not going to run out and get another certification because I have too many things I'm already doing.
I
What would
know.
be something if there's someone listening who is in the field or as a healer that they could do that would be an easy, and I don't want to simplify it and say it's easy, but just a
Yeah.
few really important, I'll put it that way, things that I could do going forward saying this is something that would be good for me to be informed of so I can help people I'm helping.
I think that would be putting together a resource list of where the
Resource list.
resources are.
Okay.
Putting,
Done.
right? And I left out one more important and really fun uh, domain, the a fourth domain that is veterinary social work, and that is animal assisted interventions,
Oh, okay.
which, I would have loved to have done, but my successor pet to Joni,
Yeah.
her name is Aretha, but we call her
Oh,
Riri,
oh, that's cute.
and she shows up in my Instagram videos. She's a diva and will not allow me to have other pets, so there's no way I'm ever going
Oh,
to have a
that's so
dog
funny.
as long as
Hmm.
I have her. But animal assisted intervention is just a wonderful. There's so many areas that you can use it. In nursing home with kids, in therapy itself, you can have them as part of your therapy. People relax when there's a therapy dog there. There are people that bring therapy animals to the court.
Oh,
So,
okay.
I remember learning about this in my training. There was, for example, a case where a young child was abused, sexually abused, and had to testify or something. And they allowed the dog, that was like a big golden retriever dog, to come into the witness box,
Oh,
where they
that's
sit.
amazing.
And the jury couldn't see the dog, so they,
Yeah,
they brought her in first, and she was able to have the dog with his head on her lap and pet him while she testified.
that's incredible.
And that brought down, because we know animals, being with them, petting animals will bring down our stress response. And, maybe this is something that the highly sensitive people that you work with might be interested in, you know.
Well, and it's interesting too because I'm thinking about you were saying your different animals that you've had. I had one before I had children, my dog Jake, and I always call him my love of my life dog because he was just like we were. And I think there's something to be said about your pets before you have children because you're
Uh,
pouring everything into
yeah,
him.
sure.
And for those of you who are pet mamas and daddies and you are pouring everything into them, And he was very much a highly sensitive dog. So high sensitivity was first discovered in animals. It wasn't discovered first in humans, who are animals. But it is present in all species. So all species, from dogs to birds to bugs, there are ways to test for sensitivity in bugs. And the interesting thing is the statistic is the same. It's 20 to 30, and this is kind of a range, but roughly a third of each species falls into the high sensitivity category, which is very
Interesting.
interesting.
Yeah.
And so I was thinking about what you were saying with being in the witness stand. Jake would have been amazing. Like, he would have come in and put his head on my lap. He was a highly sensitive dog, very in tune. For that reason, though, also he was a little bit more neurotic. We have these funny stories about my girlfriend Myra and I had gone out like on this river with a raft, and he freaked out, came out. This is Jake. Grabbed the raft, dragged us back in because he thought he was saving our life, and then destroyed the raft.
Oh no.
Which I felt bad for my friend because it was her raft.
Yeah. But he was
Whereas
trying to
my
help.
dog now,
Yeah.
Lenny, who many people know because he's kind of he's so good with my kids because he can take anything. He's Teflon. He's so resilient with playing and whatnot. But if I was in a witness stand and I was upset and I needed Lenny in there with me, he would just stare at me. He would just be like, "What's wrong with you?" There'd be no head on the lap.
Yeah.
He's affectionate, but I feel this energetic pull. Like, he's affectionate for himself, if that
Yeah.
makes sense. Whereas
Yeah.
Jake was very much like affectionate for you. So it just kind of makes me laugh. But I would imagine a person who is an animal social worker who does this is able to pick up on this probably. Like, are these animals good and well suited for the
Uh,
therapeutic setting?
I think people that have had a lot of experience may be able to tell, but it can be very hit or miss.
Yeah,
You can just get lucky and have the kind of animal that is very calm, is not reactive,
right.
can be, for example, if you have a cat, that cat is comfortable being leashed because a lot of the hospitals require that they are able to be on a leash.
Oh my gosh, I've
Um,
never known a cat that wants to be leashed, but I
oh
guess there
yeah, no,
is.
there's lots. No, a lot of people are walking their cats now. It's pretty cool.
You
Yeah,
live in the city, right?
yes.
I feel
And
like you're probably seeing more cat walkers than I am.
well, the thing is that I live in the city, but this is like one of the worst places probably to walk a cat because there's so much going on. But
Yeah,
you do see
yeah.
people that will carry their cat around and things like that. Um, but I think it there are shelter animals. A lot of the shelter animals do become not emotional support animals, but therapy animals. So the difference is that a service animal and a therapy animal are usually certified in some way. Emotional support animals is really kind of fading out because fewer and fewer and fewer
Right.
airlines are allowing it, and pretty much it's only for housing that you can get an ESA letter. But a therapy animal and an animal that is a certified psychiatric service animal
Right.
is trained,
Yes.
and
Very
it's a
heavily
very
trained
big
from
difference
early
between the
on.
two.
Right.
But for therapy animals, there's a wonderful organization called Pet Partners.
Mm-hmm.
So, Pet Partners is an organization. If anyone listening is interested in being a volunteer therapy animal team, they can look up Pet Partners because they train you and get you started. And when I was at the clinic, that was one of the things in my project. Is during the pandemic, our medical staff was so stressed out,
Mm,
and especially
understandable.
especially nursing. Yeah. Oh yeah. And so I brought therapy animals in, so that people on their lunch hour, and not for the patients, but for the workers, the staff, they could come up to the administration floor and just sit with a wonderful dog and interact. It was a beautiful thing to see. Everyone felt so much more relaxed and relieved when they went back downstairs. So
It's interesting. I'm
it
thinking
works.
about last Friday. I was at kind of like a celebration of life for someone, and
Hmm.
uh, the person's, and just for privacy's sake, I'm not mentioning who it is, but
Yeah.
the person's cat was there, like in the room and walking around, and it became almost like the cat was almost like a focal point the whole time,
Oh,
like it,
yeah.
and you could see almost like everyone's kind of passing around the comfort, and I think it was a she. Admittedly, I'm allergic to cats, so I did not pet it. Although I think there's a real thing when cats know you're allergic, they want to hang out with you more. They're
I
like,
have the explanation for that if you like.
really? Oh,
Yeah.
please. I actually want to know this.
So, cats, most cats, now every cat, cats have different temperaments, just like
Yeah.
humans. But the reason for that is cats tend to feel more comfortable with people who aren't pushing them, right? Riri is very much like that. Aretha's name is Riri for short. If somebody comes in, they're like, "Oh, kitty, oh, I want to pet you." She's like shoo, under the bed, or
Right.
she whacks him, and. Uh, but if somebody comes in and completely ignores her and kind of
Like
goes,
I would. I mean,
"Yeah,
I might from afar say, "Oh, that's a cute cat."
yeah, yeah." So because you're not you to a cat, you are safe,
That makes sense.
right?
They're
Because
like,
you're
"Oh,
not.
you're playing hard to get. We like you."
Yeah, yeah. You're well. I would say you're giving me space. Cats need
Oh,
space.
yes.
Cats, if somebody, if you want to teach someone about consent, bring a cat because cats are the ultimate consent animals. So,
Good
for
point.
example, like in the shelters, you'll see there's some videos they show of this that you sit next to the cat. If the cat's just been brought in and you're just trying to orient them, you sit to their side. Don't look at them. Just sit to their side. Maybe hold out your hand to let them sniff your hand, but just it's a real slow process. So that's why the people with allergies are trying to say, "I'm good." And the cat's
Uh-huh.
like, "All right, you're safe. Let me come over and check you out." And that's why.
I love that. I
So,
actually have been actively working on teaching my 5-year-old son about consent because, when he has a foam sword and he's coming at his sister and she yells no. But he
yeah.
loves, we obviously don't have any cats, but he loves the grandparents' cats. And there's one particular cat that he loves that's extra feisty that you have to be super careful. I'm going to use this. I'm going to start using Bodhi, the cat,
Yeah.
Bodhi's temperament to describe how he needs to handle consent in general. Because I do think
Oh,
consent early, and I use the term consent. I mean, we talk about it actively because I do think it should be such an integral part of raising our kiddos. So I like that. Thank
yeah.
you for the cat metaphor.
Sure, of course. She we had a fire in my building when she was about a year old. I was not home. I was at work, and my neighbor called me,
Yeah,
freaked out.
understandably.
And when I
Yeah.
got home, it was the floor above us, and across the hall was a small apartment building. And she was terrified. She was like hiding under the bed. You could smell the smoke. There was so much noise. I'm sure the fighters running up and down, and that kind of traumatized her. Plus, during the pandemic, she doesn't like the vet, and if I needed to take her to the vet, I could not go into the vet with her. Right. So I think a lot of that had kind of traumatized her.
Yeah.
So she has, I guess, anxiety. And I worked very closely with a behavioral vet and with a trainer. And we did a lot of work, and it's really made all the difference. And it's so funny. Like, I'm the shrink with the cat that needs a shrink. But I learned a lot about animal behavior because of this. And, I took copious notes from every day to figure out like why she would attack me. And I took a lot of notes and I realized that she would always attack at night as I was getting ready for bed. And either like I would start getting into the bed and she would jump up and grab my arm, or I'd be walking from the bathroom to the kitchen. She'd wrap her body around my ankles and hold on with claws and teeth. It was horrible.
Yeah,
And
it
all
sounds
right. And I realized that it always happened at that time. And then I thought, gee, I wonder if she's thinking, hey, this broad's getting in bed, going to sleep. and there's going to be 8 hours with no food. Oh no. So
Oh, yeah, that's
she's very
smart.
food motivated. So I realized, let me try after I brush my teeth and make sure the kitchen is clean and all the things I need to do before I go to sleep, I feed her. So I always give her a little
Interesting.
snack before bed, and all of that stopped.
I
Right?
love that. I mean, that really is if you think about just raising any, it's almost like you're raising your cat. Raising anyone, whether it be our child or our animals, if we just look at the behavior as a nuisance, we don't actually get curious about it. You can't
Yeah.
think of any potential creative ways to address it. So
Yeah.
that is really that makes a lot of sense.
It's all learning about communication, right?
Yeah. So I love this
Yes.
because you are very, it sounds like your special interest really falls in this area of animals and the social work piece and how you were able to combine it. It is not completely common. And I'm going to shift gears a little bit
Sure.
here to find someone who knows that they have ADHD and talks about it and supports others with it,
Oh, yeah.
who is able to experiment and try enough things and marry it all together and feel fully employed. Do you know what
Yes.
I mean? As opposed
Yes.
to feeling underemployed or like you're not living your purpose or getting the projects done or the things you want. I just see that so often, this kind of missed opportunity energy.
Yeah. Yes.
So I'm wondering
Yes.
if you could speak on that. Like, how did you get to this place where you are fully employed and you are doing and living your purpose? And how the heck did you write a whole book
Oh
and
my
make
God.
that happen? For all of those listening who have so many,
Mm,
and I think this falls really in the category of HSPs and ADHD because highly sensitive folks have so many different things they care deeply about
yeah.
that they want to do, and it's hard to choose. And then you throw, if you have ADHD into there, the kickstarting and the failure to launch issues. So, yeah, I'm just going to put that out on a platter for you and see what you come up
All
with.
right. Well, we would be on here for hours if I gave the whole story. By the way, I'm 66, and so I've had a couple of careers, right? I've had a chance to do that, and I've always gone where my interests lead me. But just very briefly, at the time I was working in entertainment news, and it was all gossip, gossip, gossip. And I just wanted to talk about, what motivated you to write this song, or tell us about your process in the movie. But it was like, no, tell us who you're dating and what you're wearing. It's like I got ugh.
Where did you work?
um, I created a website called lamusica.com
Okay.
that was sold. I created it in 95, and it was we sold it to the Spanish Broadcasting System. So I worked on all their radio websites and on their morning show in New York for like 5 years. Then I
Gotcha.
worked for
Okay.
CBS News, CBSNews.com's entertainment section. And then I worked at a syndication company called United Stations Radio. It was owned by Dick Clark.
Okay.
And we did what's called show prep. So we would prepare a package every night that the morning shows would download, and they'd have their jokes, they'd have their interviews, they'd have their latest news. And I was the producer of that product.
And you did all that before AI.
Yeah. Oh my God.
Before the help of
It,
AI.
it was just I at that
Yeah.
point. Yes,
You, I, me, I. Yeah.
exactly. But while I was working and I was volunteering at the Red Cross, I had lived in Battery Park City during 9/11, so Red Cross fed us after 9/11 and
Wow.
and took care of us. And I wanted to, give back and volunteer. And I worked on the disaster hotline so that during Katrina, people would be calling us for resources, which you talked about earlier. And we would always have a mental health professional in the room with us. And the social worker that I worked with, Diana, said, you'd make a really good social worker. And me knowing nothing about social work, I was like, oh, I could never take children away from their families because that's what people think.
You're like, I
Social,
don't like being in the court.
I know exactly. She says that's not what social work is. What you're doing is what social work is. You're providing resources and you're providing emotional support to people. So one day I walked out of the one of my volunteer shifts, and said to myself, gee, I wish I could do this all the time. This is so fulfilling. And then I said, why the heck not? And so I quit my job. I went back to school. I only had 23 credits. I finished my bachelor's. I got my
I
MSW.
want to highlight that for a moment because I think a lot of people who haven't finished a degree in the first place feel like it's too big of a hurdle
Yeah,
to keep going. So you didn't already even have the degree. You had to go back and finish what you had started, which is very common for ADHDers,
yes.
right? So
Yeah.
I just wanted to really nail in on that.
Oh, yeah. And, I want to encourage people to go back to school because, oh my gosh, school is so much easier when you're a grown up. It's no,
Good
like,
point.
I wasn't distracted by boys. Um, and I was paying for it out of my pocket. So I really
Yeah,
wanted to make the most out of every dollar and get the most out of every class. It was something I was really interested in. It wasn't something my parents were telling me to do.
right.
Plus, I had been a journalist, right? I had been in IT before that and training people to use uh, computers, like really the early days, and really early. And so I was able to write a paper without a problem. I was able to do presentations in class, no problem. I was able to make a deadline. Even with the ADHD, I was able to do all those things because I had that experience on the business side through the
Mhm.
world of work.
And I can speak from the other end because I'm a professor and I work with counseling students.
Hmm.
I notice a distinct difference in the confidence level and the dedication level, truly, between and I'm saying this as someone who I went straight through. I was a
Yeah.
baby when I was in grad school. I was one of those and actually, it was because of 9/11. I've told the
Ah,
story before. I worked in the city at MTV for some from upstate, but I went down for a summer and interned at the MTV, and I was on track to come back and to
yeah.
work in the city after I graduated. I think that was my senior year, and then 9/11 happened,
Yeah.
and I remember feeling like it was an exciting job and opportunity, the art department where I was, but there was just something that wasn't lighting up. And I remember seeing a short clip on Oprah about an art therapist, and it was kind of like that moment for you where like, I wish I could do this all the time. And I'm like, maybe I should. So it was early. I'm not saying that doing this early on is um I understand I was in a position in life where it was an easier time, it was more
Yeah.
expected. However, I was almost done with school. I had to quickly apply to all these programs. I got waitlisted everywhere. And I called the university I wanted to go to every single day for 3 months to check the status of my application. So there's different crazy paths, but when you get
Yeah.
ignited and you
Yeah.
follow that, but so you were saying that as an adult with ADHD, it felt different than maybe as a younger person with ADHD trying to get through school.
Oh, heck yeah. Because you're so easily distracted by. I mean, I moved here to New York when I was 18 to NYU, but at Tisch School of the Arts because it wasn't called Tisch back then. It was just NYU School of the Arts. And I was a dancer, but just the city was just like, wow. Being
Yeah.
18 on your own when the drinking age was 18, I might add.
Oh boy.
1977. I came here in the summer of Sam. It was insanity.
I bet.
And oh my God.
For anyone not watching and listening, her face is lighting up remembering this.
It was something else. And I just got distracted, because I didn't get diagnosed with my ADHD till I was 36 or 7.
That sounds pretty on point with the
Yeah.
typical age. Yeah.
Yeah, and
Mhm.
and it's so funny. We have so much in common because it was
Mhm.
thanks to Oprah. Because
Really?
yeah,
Oprah, are you listening?
I
You
know. Because I had been a heavy smoker. Most dancer in those days, a lot of dancers smoked because it was better than eating, so you would stay skinny.
Mm.
And I was like a 2 pack a day smoker,
Mhm.
and I quit. What I didn't know was that the nicotine was actually treating my ADHD because it is a stimulant, right?
It is a stimulant. Yes, for anyone listening who has ADHD, treating the smoking not just as something that's, a quote bad habit, but actually a form of medication. I think I've seen, and actually, is it Wellbutrin? I believe Wellbutrin was originally created as a smoking cessation medication, and then they
Yes.
discovered it actually helps with ADHD symptoms. So when we see these pathways cross, there's a reason.
Guess what I've been on since 1997?
What?
Wellbutrin.
Okay, see, proof is in the pudding here. We have a case study on our hands.
Yes. So my life was falling apart. I was doing the computer consulting at that point. I like was missing deadlines. I lost a really important client file. Bill collectors were calling because I hadn't, gotten around to paying. I could have paid, I had the money for it, but I threw the bills in the pile. You know how it is.
Yep.
And it was like 1 a.m. on the Oprah repeat at night. That
Uh-huh.
used to happen. And
Yes.
I'm like on my computer
After the
and
American flag, or was that before? I don't know.
yeah, Star Spangled Banner.
Yep.
Yeah. Um, and they had somebody on about adult ADHD.
Wow,
And
I have to go find this.
yeah, I haven't been able to find the episode. It's like, I think it was
Really?
1996, 1997, around there, but yes. And I started crying because I was like, oh my God, that's me. That's me. That's what's
Wow.
happening to me. And then I thought, and I was crying not out of being sad or angry or upset, but I was crying out almost out of happiness because it was
Of
out of
course.
relief, out of
Yes.
relief. So
Like I
like
know finally. Hmm.
I have a thing, and that
Hmm.
thing can be treated,
Oh, that's
right?
amazing. Yes.
And it's not that I am, there was a wonderful book back then. I don't think it's been revised, but it was called "I'm Not Lazy, Crazy, or Stupid."
Oh, okay. I'll have to look that up.
Excellent ADHD. Yeah, see if you can find it. It's a really good book. And that kind of is what went through my mind. It's like, oh, wait, it's not a moral failing.
No.
And it was just such a revelation. And I went on, I was Googling, well, it wasn't Google back. Was it Google back then? Yeah, there was Google back then. Okay. I was,
Yeah, I was like, I don't remember when that came. You're like, I instant messaged
uh,
someone. Just
yeah,
kidding.
right. Yes, it was on CompuServe. But I looked it up and I was reading and reading and reading. It was called Hospital for Joint Diseases back then, but I found um, one of the top guys in the field at the time, Len Adler. If you know about the ASRS, that screening that you
Yep.
do for,
I used it in my doctoral dissertation, actually.
okay. So
He
Dr. Adler
created
created
that.
that, and
Yep.
that's who I looked up, and that's who I went to.
Oh,
So
well, you went right to the source.
right to that. I'm a right to the source kind of gal.
Yes.
So
Also,
yeah.
probably one of the benefits of living where you live too,
Oh yeah.
right? Yeah,
Oh my
because
God,
the
yeah.
source is there.
It usually is, yeah.
Yeah.
And he did a full diagnosis, including the computer test where they have the letters float down and you have to hit if it's a letter, hit if it's a
Wow.
number, all that stuff,
Yeah.
lots of information. And he prescribed Wellbutrin with a boost bar chaser
Nice.
because Wellbutrin can,
Like you have on every cruise. No, I'm just
yes,
kidding.
exactly. And I he referred me to one of the psychiatrists that's in his practice who I saw for therapy and medication. And I hired, what's her name? She's pretty well known. Julie, I can't remember her last name, but she's an professional organizer.
Oh, okay.
And she helped me organize my office and my home.
I love
And I
that.
did coaching with Franklin Covey. So I did all the
I mean, you
domains.
literally, and you know what's really incredible? You did
Yeah.
all of this before even one single female-oriented study on ADHD had come out.
I
Did you
think
know that?
I did not know that. I know
They,
that.
yes, late 90s, early 2000s was when
Yeah.
women were finally being included in
Yeah.
these studies. So the fact that you, or almost like I mean, you were such an advocate for yourself. That's incredible,
Well, it was on the advice of Dr. Adler to do this kind of holistic
right?
approach. But yeah, and it really made just turned my life around because so ever since then, I did all the work in the entertainment field that I talked about, and went back to school and got my bachelor's and my master's. And I worked in rehab for 4 years, outpatient rehab. Really loved working with addictions. It's a wonderful field. I mean, it's
Hmm.
just so rewarding. And wow,
Yeah,
when you
that
see
was actually
people
my
change,
favorite job other than the
ah,
practice I have now was the methadone clinic in downtown
yeah,
Raleigh. It was
yeah,
hard work and I had to be very, as a HSP, I had to be very careful about taking too much stress in physically.
yep,
But that's
that
where I
distance.
learned that I wanted to do trauma work was
Yeah,
actually in that job.
yeah. Oh,
Hmm.
absolutely, because it's always almost always there.
Right.
And that led to me, as I said, doing the volunteer work, getting the VSW, incorporating in the outpatient, and then now the plan always has been to go into private practice. And I waited until I was eligible for Medicare, so I wouldn't have to worry about insurance. And I started my private practice 2 years ago.
Oh, wow.
And so I have uh, a couple of different domains. I do treat people with ADHD, adults with ADHD. I went to Beck Institute. I'm a Beck Institute CBT certified clinician. So I really love CBT and works so well. So I do treat like anxiety disorders, panic disorders. I love treating phobias. It's so okay. I said it. It's so much fun, actually. But it's also super exciting to see somebody who's been terrified of something their whole life
Yeah.
get in 6 to 8 sessions get over it. It's just
Yeah, extinction
incredible.
and exposure type therapies. Is that what you use with?
Yeah, it's gradual exposure. It's the
Right,
cognitive CBT framework of gradual exposure.
right.
And I had a little girl that was scared of bugs, and her mom sent me a photo on a Sunday. We're
Uh-huh.
at the Museum of Natural History. Look at this photo, and she had a giant moth sitting on her head.
Oh, that's so
And
cool.
her mom said she wanted me to send this to you so you could see it.
Oh,
But
you
I
would,
don't want to,
no,
huh?
I was gonna say you would love, there's this one session, and I'll have to send this to my client that
Yeah.
I did it with. She normally is an in-person client, but she had to do a virtual session. Actually, I think it was after the hurricane out in the west of, she had been at her family's
Uh-huh.
cabin, was stuck out there essentially. But we were talking about spiders, something along the lines. And
Yeah.
so I asked her, would you want to try something really crazy today? Because you're virtual and we have an opportunity to do something we wouldn't normally do in office. And she was willing to go out and sit outside, like on the dirt for our session. It was wild. And let's just say there was some spider exposure. It was a really fun session that she did it. I was so proud of her. So sometimes it's not a one and done deal, though. I mean, sometimes it can
No,
take
no.
multiple sessions.
Oh
Uh,
yeah, I would say 6 to 8.
yeah. Okay, two things are coming to my mind. One,
Yes.
as my special interest is pinging with ADHD, I have to stay in touch with you because I am writing the first manualized ADHD comprehensive treatment for women with Norton right now.
Oh my gosh, yes.
I
I
can
am
say
all
that
yours in any
publicly.
capacity. Yes, yes.
And I would love to stay in touch with you and maybe hopefully consult with you as I'm writing this. So we'll have to stay connected.
Oh, I would love that.
Do you know what I love so much about your story that you just told the narrative of what happened and how did you write the book?
Oh, I haven't
Because
even
we
gotten to that, but yes.
yes, which we'll get to that because I'm sure there's some nuts and bolts, but do you know
Yeah.
what's really exciting to me about what you just did instead? I think people with ADHD hear the behavior modification so often. Like, okay, so I set aside this time of day and I put this reminder on my calendar and I do want to hear what worked for you.
Yeah.
But your answer instead actually highlighted what helps people with ADHD actually succeed. And it's allowing yourself the time to try different things, to make mistakes, to fail forward. And not that any of it's a mistake, any of it is just like a path towards what you want. For those of you who love someone with ADHD or know someone with ADHD, if you see a strength in them and you see something like to the point of that woman, you were saying it was a woman that worked at the Red Cross with you. Is
Oh
that who it
yes.
was?
Yes, yeah.
That is such a gift. Like if you see someone else, and especially I love like women supporting women. If we see
Yeah.
someone else especially if they have unmasked their ADHD and we notice something in them that they're good at or they're skilled at or gifted at, let's share that with them. Like, let's tell them because what a gift for her to say, you actually
Yeah.
are doing social work. You are gifted at this. And so sometimes all it takes is that one message from someone. And
Yes.
then to your point, when you find your special interest, and I relate to this so much because undergrad and everything, I got through just fine, but it was arduous because I don't care about oceanography. Like for example, that was my worst grade. I thought I liked oceanography until I realized, fish kind of freak me out. Um but you found your special interest and I relate to that because once I got into grad school and my doctoral program, I like nothing could get in my way. I'd done better than I ever did my whole life, and I didn't realize that it was there the whole time waiting.
Yeah. Oh, absolutely.
So you're going
Yeah.
to be more likely for anyone with ADHD listening to do the thing you're excited about. If you make the mistakes, fail forward, and no matter when it is in your life. And to your point, the older you are actually with ADHD, the more likely you're going to succeed.
Yeah. Absolutely. Because by then you've developed certain strategies.
Right.
Like in school, I would write in my calendar the due dates. Let's say I had a paper due on March 15th. I would put in my calendar that it was due on March 8th.
I do the same thing. I do the same thing. I freak myself out with fake deadlines.
Yeah, it
Oh my
works
gosh.
every time. It works every time.
Mhm.
But yeah, so my practice is a private practice, virtual practice. I'm licensed in New York, New Jersey, and Connecticut
Oh, nice. So the
because it
whole,
made no sense to be licensed in New York and I can look out my window
yeah,
and across the river, I see New Jersey.
right. That
Like
makes
it's right there. You
right.
know, why can I treat somebody in Buffalo, but I can't treat somebody that I can actually see their building? It's
Yeah, I
like
hate that for
nuts.
our
I
field.
know it's really hard. They're working on the compact, but not yet. So it's virtual, and I do my main areas are pet bereavement, adults with ADHD, people that are in the creative and performing arts because of my arts background.
Right. Hmm.
And, my clinic that I worked at for 7 years was in Hell's Kitchen. So I had a lot of Broadway people, dancers, actors, and so on. And, it's LGBTQ friendly. So people that, have issues in that area or just, want to be with somebody that with whom they feel safe.
Right.
That's part of my practice as well. And what's so interesting is that people will come to me for pet bereavement and we'll work through the grief and loss. But a lot of times they'll stay with me for other things that they want treated because we
Right.
have a rapport. And I have the background in treating at the clinic, especially depression and anxiety were the two main things that we treated. So it's like, come for the bereavement, stay for the anxiety. It's like that's who I
That'd
am.
be a good ad.
Yeah, right. But the truth is, that's something that comes up a lot in grief is that um, if people are kind of stuck in their grief, a lot of times there's more to it than just the loss. And for example, I do cognitive processing therapy for PTSD. That's a therapy developed at the VA that comes out of CBT. And a lot of times the grief, the loss is a traumatic grief because they've witnessed, for example, I talk about it in the book. I had a client who witnessed their dog being run over by a car, and
Oh,
that's a trauma.
terrible. That is
It's,
a trauma.
yes, I mean,
Oh,
you remember this is from grad school or it's in DSM. One of the criteria for trauma is feeling that you yourself are in danger
or
of
someone
serious
else,
injury or death or
especially
someone
someone you care
else.
about. Yeah.
So if
Right.
you witness that with your dog, sometimes euthanasia can go wrong. Not go
Oh,
wrong, but
yeah.
you
Even
know,
if it goes right, too. I mean, the
well,
people
yeah.
get stuck with the imagery, too.
Well, yes. And
Yeah.
so it should be a peaceful sleep-like process, but
Yes.
sometimes the animal will actually look like they're struggling or be
Yeah.
struggling if it's done incorrectly.
Hmm.
That can be traumatic. There's ambiguous grief where the loss is that you don't know what happened. Your dog ran away, or there was a terrible storm. Like after Katrina, there was a lot of that.
Oh, yeah.
Um,
Imagine.
so those issues have to, usually it's best treated first. And then, once we get past the PTSD and get that down, reduce that, or treat that, then we can move on to actual mourning and loss.
Can
But
I
so often the trauma's holding them back.
Right. Can I ask you about, you just said a term that came up. It didn't actually come up in my episode last week with Rebecca Thompson that's going to be airing this week. um, but it definitely applied to that episode, and then you just brought it up again, and I wanted to ask if you could define ambiguous grief.
Sure. It's the type of grief where you don't know what happened. You know that your loved one, and again, all these terms apply to
Right. And
human
we were talking
and
about fertility, loss,
yeah,
miscarriage.
yeah,
Right.
yeah. And you don't know what happened. And you get no closure as a result. Not that you need closure. I hate to use that word because people misuse it, I
Well, it's
think.
part of the trauma cycle. Like the
Well, I'm not like a five stages gal, kind of,
Gotcha. Mhm.
because the five stages actually, Kubler-Ross was a pioneer.
Oh,
Um,
right. Yeah. It wasn't even designed for people grieving. It was designed for people
correct.
who had cancer. Yeah.
Yes.
I was thinking more somatic, kind of like Levine
Oh,
with like completion of a trauma
yeah.
cycle. Like
Okay.
you like
Yeah.
have some resolution.
I see what you're saying. Yeah.
Right.
Yeah. So
Thank you for calling that out.
that's okay. Um,
Get a couple psych nerds together and see what happens.
oh, here it goes. Yeah, exactly. But you don't have, you have so much guilt because you feel responsible for them being lost.
Right. Okay.
But this could be, sometimes animals are stolen. It could be that you were bonded to an animal that wasn't officially yours. For example, like it was your boyfriend's dog,
Yeah.
and you split up and they move away, and you just kind of aren't in contact. So you are always wondering, how is he doing? What happened to him? Or you rehome a pet.
Or I'm thinking of my mom who literally feeds forest animals.
Oh, wow.
They like give names to them,
Is
and
is
then
her
if one
name's
just stopped coming by, there would probably be some ambiguous grief of not knowing what happened.
is your mom's, was it Sleeping Beauty or Snow White with the birds? I
There have
forget.
been moments. This is upstate New York, so like
Okay.
we butt up to a bunch of woods. But we were up there for Christmas, and I looked out the back window, and at one, one moment there's deer, there's birds, there was a raccoon. It was just like, and it
Was
was in
she
the evening.
singing? Was she singing in a long gown? Because
I mean,
maybe the daughter of a princess, and we don't know that.
there's a lot of Buddhist energy back there. I'll put it
Ah,
that
okay, that
way.
makes sense. Yes, so you never know.
Yeah.
Um, but yeah, so that is what ambiguous grief. There's an ambiguity, and I forget the name. There's a gee, I forget the name, but there's a researcher that's written a lot about it. She's a great website with a lot of good information on it. I do quote her in my book. I have a lot of references in my book. It is a self-help book for just anyone who's lost a pet or is suffering from anticipatory grief, which is when you have a severely ill or injured animal and you know they're
Yeah.
not going to last that long. But I tried to make my book as evidence based as I could.
I love that.
I knew you
I
would.
love that. That's what keeps me hooked in a book. When it's just platitudes and sales pitches,
Yeah,
I get very bored. So
yeah.
I always say I like science help books as opposed
Hmm.
to self-help books.
You'll find that in my book. So
Hmm.
you want to know how it happened?
Yes. Yes,
So
that's our grand finale, folks. How did the
okay,
book actually get written with
this is
ADHD?
it is hilarious because here I am. I started my private practice. I was able to build it quickly. Shout out to Therapy Practice Accelerator. They're consultants that help me with my website and teach me about marketing and Google Ads. And, I've been able to,
If you would like to sponsor this episode, feel free,
yes,
guys.
yes, exactly. Oh, I'm sorry. I shouldn't have done that without a
No,
sponsorship.
do it. Do
I worked in
it.
radio. I should know better. I'm so sorry. Uh, um,
No, we'll be reaching out. Don't worry.
okay. All right. So I get an email and it's from Penguin Random House, and it's like, what?
Yay.
And and they said we found you. We read your website. We love what you wrote about pet bereavement, and we're creating a book about pet bereavement, and we're looking for a subject matter expert essentially to write the book. So in publishing, and you know about this, you know how Zeitgeist works.
Oh, yes,
Uh,
we're both zeitgeist ladies.
yes,
Yes, I
exactly.
forgot about that. Yep.
So in publishing, it's very difficult to write your first book. You have three general options. One is getting an agent and getting a publishing deal, which unless you're a celebrity or an influencer with millions of followers, agents really don't care unless you've got
Right.
like this
Especially for your first book. Like I was
the
saying very
first book.
casually earlier that Norton and I have a deal now, but that deal wouldn't have happened because
No.
they actually reached out to me, Norton
Oh,
did.
nice.
I know that deal
Yeah.
would not have happened without Zeitgeist because
No.
Zeitgeist was, oh, I could not say enough good things about
I
them.
know, right? So
Mhm.
you can if you already have a following or you have a really interesting story in the news, you're not going to get a deal with an agent usually. The second option is to self-publish, and that's a
Done that
numbers
too.
that and as you know, that's a numbers game. And a
Oh,
lot of people that do successfully in self-publishing have written multiple books, and
right,
over time, the combination of those 10, 15 books selling, they'll make some money out of it. And the third
right.
is to do a book work for hire, which is what this was. So what that means is you don't have publishing rights or you don't get royalties. But I figured in my field, it's people get to know who I am, what I do, and it's great marketing for it. And I felt that I could do something a little different than a lot of the books that are out there,
Mhm.
in the sense that I am trying to make it, as I said before, more evidence based. Really talk about the therapeutic interventions, teach a little bit about the different models of grief. So I kind of have all that in there and a lot of the activities that I do with clients. So that was there's a lot of really wonderful pet loss books out there.
Mhm. And you know what's
But
interesting when I think
yeah,
about the nitty-gritty of writing a book with ADHD, the way that Zeitgeist does it is
yeah,
actually very ADHD friendly because you
yes,
work with an outline and you have someone it's interesting right now. Again, I'm referencing the ADHD book I'm writing. I'm actually the one having to kind of come up with my timelines for that because I have way longer. I have about a year and a half to write it. And
wow,
yes, it's like a whole new world. And so one day I was sitting there going, okay, when do I get my chapters to my editor? So I actually reached out and created false deadlines for myself. Like, okay, I'm going to get these chapters to you by May kind of
yeah,
thing.
yeah,
Whereas with Zeitgeist, it's actually very ADHD friendly or right to, what is it? Pay to hire. I always mix it up. Work
work
for
for hire.
hire
Yeah,
because it was very fast. It was what,
yeah,
3 or 4 months?
yeah,
And in the books are still very dense, but you're in this kind of hyper speed mode of writing, which actually, according to research, works really well for ADHD because
yep.
there's been research that shows that mini semesters are much better for ADHDers than full semesters in college,
That makes a lot of
right?
sense.
Because
Yeah,
you're getting more crisis, more of a crisis energy, more triggering energy, more stimulus. So if anything, and you're someone out there thinking, okay, I've had this book at my fingertips or this project or this whatever it is you want to do. I almost said nonprofit, but that's a big beast to try to put into this metaphor.
yeah,
Giving yourself a person you're accountable to, because that's what we had with Zeitgeist. We had not only the overarching, but in that, with them, I found my editor and I were talking a lot.
yes, yes. I
Yes.
love my editor. Yes.
Can I ask who you worked with?
Uh, I work with a couple of different editors,
Okay,
and
we were in different topics, so it probably wasn't.
yeah, the same. Yeah.
But we were working with someone we were accountable to. We had an outline and we had a shortened deadline. If you think about it, that kind of works really well for the ADHD brain.
Yeah. Oh, yeah. 100%. That
I hadn't
because
really thought
we
about that.
need, yeah, we respond to if something is novel and if
Right?
something is urgent.
Right.
And there was that urgency, and of course it was a
Yes.
novel experience. But um, what is interesting that I didn't know, and my editor wrote in the book, she writes basically an editor's note in there. Um, she doesn't put her name on it, which is why I didn't say her name. So
Oh,
I'm
no,
not
that's a
sure.
good call.
Um, but anyway, what I didn't know when we were working on the book is that she had just lost her dog.
Oh, so she was really close to the subject.
Yeah. And I
Yeah.
didn't know it the whole time until she said, I'm going to put an editor's note in there. Is that okay with you? And I said, sure.
Oh, I
And
love
that's what the
that.
editor's note is about. Isn't that insane?
I wonder if they do that on purpose because when I wrote Powered by ADHD, they paired me with someone with ADHD. And when I wrote
Maybe.
Gaslighting Recovery for Women, they paired me with someone who was super passionate about the topic. So it makes
I
sense.
think so. Well, you want somebody that,
Yes.
because you don't want somebody, when you write a book, as you know, the editors sometimes do some rewrites.
Yes.
And, there's certain things that I feel very strongly about in terms of what is evidence based.
Right.
And it was a different, we have like three or four different editors through the process. And it was one of the, I think, copy editors or somebody.
Right.
Somebody had said, what is it? They had instead of saying research suggests, um, it was like, what is it? Research proves.
Oh, yeah, you don't say that.
I lost my,
No, you
sugar
don't
honey
say
iced
that.
tea at
Nope,
that
nope, nope.
point. I
That
was
could have
like,
discredited your voice for the whole book. Yep. Good
I'm
call.
like, I was like, I've got a license to protect.
Yeah. Well,
So
and just your intellectual property to protect even.
yeah,
Yeah.
yeah. So, I mean, that's the whole thing. I really wanted to, again, make it evidence based. I refer to, different models of grief and give credit. I quote Mary Frances O'Connor. If you've ever read The Grieving Brain, she's amazing. She's the one that does I don't know if you've seen her work, but she's done fMRI studies about the different, uh, looking at the different pathways of the brain and how they work in grief and understanding. And that answered the question of why is it that I have clients that will say to me, I know my dog is gone. I was there. I was present for their leaving this world, but I feel like they're out there somewhere.
Mm, hmm.
And in her research, she talks about one pathway of the brain is, you know, has that memory, knows that this thing happened, but there's that attachment bond that we have with loved ones that predicts that they will be here, when we come home, that they will jump on the bed. And it
Right.
takes our brain longer to learn that that's not happening anymore.
Right.
And
Yeah, that makes
so we have that dual thing going on in our mind in the early days of grief where you're believing two things at the same time. They're gone, but they are still here. And that causes a lot of the distress.
I can absolutely see that. Well, I mean, I can relate to that in the sense that I was
Mm-hmm.
saying I was at that memorial on Friday. It's someone I work
Mm-hmm.
with
Yeah.
at my practice, and I feel like she's gonna be there when I get there this week.
Yeah.
Like it
Yeah.
doesn't, and I think that's really the purpose oftentimes of our gatherings and of our time together. And like we don't all need a $50,000 funeral, but just the action, I could see it helping with what you're talking about,
Yeah.
moving that almost moving it from like the cortical brain to the subcortical brain where we feel and we
Mm-hmm.
sense.
Mm-hmm.
You said this was done on eyes.
fMRI,
Oh,
imaging
our eyes.
studies.
I thought you were saying
Yeah.
studies on eyes.
No, that would be interesting. But I talk about different things like that.
Yeah.
I do address the spiritual. Well, first of all, the book is written. It's like 365 days, and every day is alternatively a quote and reflection about the quote, and then the next day is a related activity.
Mm.
Okay.
And can people go more than one day? Like, can they do more than one day, or would you
If they
prefer it be?
want to, they can. What we recommend to people is you can either start on the day you get the book,
Uh huh.
or just start at the first day, which obviously January 1st, or pop around and just flip through it to whatever
Right.
catches your eye. If something doesn't interest you, then, read another day. Or if something doesn't interest you right now, if it's too
Right.
painful, for
Yeah.
example, to look at photos of your animal, because I talk about photos and memories are so important. And, you can bookmark it and come back to it later if you want to. Um, and what's interesting about that, this is the ADHD part I wanted to tell you about, is so I had to find what was says 182 quotes
Oh, wow.
in the public domain
Yeah, that you could use.
that I could use. And then I had to come up with 183 activities.
That's a lot.
Yes. So I kept it in a spreadsheet because with ADHD, I would forget. Did I talk about that already?
Yeah, that would be
Did I
hard.
use that quote already? And then, it's good I'm an IT nerd because I used Excel and I would sort by the author of the quote or the
Right.
attribution because I realized that, oh my gosh, I got six quotes from the same person.
Oh, right.
So,
Yeah.
I mean, that's, I would sort it and pick it. Yeah. Um, but this is all my ADHDers out there, this is the part you're going to love. So, my apartment was tidier than it's ever been because if I couldn't think of something, I would get up and I would clean. I
Oh,
would get up and I would
as you were
dust.
saying that, I was like, oh, I know where this is going.
I mean, sparkling like Martha Stewart could come in with white gloves and been
Oh,
thrilled.
that's so funny.
Not only was the house clean,
Hmm.
guess what else was clean?
Your, I don't know, your desk, you? I don't-
Me.
You.
Me. Because if I got really, really stuck, I would take a shower because my best ideas always come out in the shower.
Yeah. So, I mean, your nervous system is just so happy in the shower. That makes
Yeah.
sense.
So, I mean,
And you're
good
not,
thing,
there's no distractions. You can't jump on
no
anything when you're in the shower.
distractions.
Yep.
And it was, spring/summer, so it was
Right.
okay. And I must have been taking like 3 or 4 showers a day.
You know what? Honestly, I say one of the best coping skills after a long day of seeing clients is a hot shower.
Oh
So
my God,
I
yes.
could totally relate to that. So
So,
I am just so excited and pleased about this conversation I've had with you, honestly.
yes,
I did not
fun.
know where it was going to go. I knew we were going to talk about your book and about pet loss, but this was so much more. This was
Oh,
so much more than I expected. And I'm so appreciative for that because we
oh,
touched on things that I had never heard of. Like I genuinely had never heard of animal social work, um,
veterinary social work.
veterinarian social work. Yes. And
Veterinary social work,
veterinary
yes.
social work. Yep. And being able to define things like ambiguous grief and just your life in general sounds like it was so interesting. I feel like your next book should be about that.
You're not the first person that said that.
Yeah.
It's
Just
been a
in
ride.
general.
It's
Okay,
been
well,
fun.
just like that woman said you should be a social worker, if people keep telling you you should write a story or a book about your life, I think it's time.
I think it is. I think
Yeah,
it is.
it's a
Yes.
great time for it. So, Judith, for anyone who's been listening who is thinking, I need help in these areas, definitely they should run out and get your book. It looks really beautiful. Do you mind holding it a little closer?
Yes, of course. Oops. You want me to repeat that?
Okay.
It's funnier that I dropped it because
Yeah. Wait a
it's
minute.
it's more ADHD. And remember, I worked in radio. I worked on morning shows, which are goofy. So anytime this is the great thing about life once you've worked on a morning show.
Yeah.
Anything that goes wrong in your life is great material.
Yeah.
I would come in the morning and
We'll make a reel out of this.
I would talk about my love life on the air. So like everyone, like 2 million Spanish speaking New Yorkers knew what had gone on in my life. But anyway,
Awesome.
it's life after pet loss.
So pretty.
And I would love for anybody that's interested in more on this to follow me on Instagram. It's my pet loss therapist is the my Instagram account, and so I do daily posts and support and tips and things that are helpful. And my website is judithevrosen.com. If somebody's in the tri-state and they're interested in doing therapy with me, they can look there. And oh, in the back of the book, I don't know if I could even show this, but in the back of the book, there is a, reference section and there's also a resource section. And in the resource section, which is in the back, I've got like
Oh,
websites and
awesome.
I've got hotlines to call. Um, APLB .org, Association for Pet Loss and Bereavement, is a wonderful resource for people. They've got chat rooms and they've got different clinicians all over the country that people can get help from. So there's resources out there. And yeah, there's help. You don't have to
Good.
suffer alone with
Right.
pet loss.
Definitely.
Mm-mm.
Well, thank you so much, Judith. And thank you for everyone who listened and hopefully can spread the word on a lot of these topics today. Because even if you yourself haven't lost a pet recently, maybe someone you know has. I have a client in particular that I want to give your book to now,
Oh, thank you.
who just lost her bunny. And it was
Oh,
like
yeah.
her definitely emotional support bunny for sure. I've met it, it's come to therapy. I always say you're welcome to bring your animals as long as they're housebroken. And sorry, guys,
Not a cat.
not a cat. I was like, it can't be a cat.
Well, I'm glad you brought the bounty up. Just real quick, the book is for anyone, any animal that you've had, and I
Any
do
animal.
address that. And I actually interviewed friends that work with had horses. I have a
Hmm.
friend that has a snake. It
Hmm.
can be any animal. So this is for any animal, and I
I love
try
that.
to be inclusive in that area as well.
Good. Awesome. Well, thank you again. And I hope everyone has a great rest of your day. Be well, everyone.
Okay, take care. Bye bye.